to dance, taking a chance. Telling me to dance, taking a chance. Telling me to dance, taking a chance.
Hello, everybody.
Good evening,
Hello.
everyone.
Good
and
evening.
welcome to another, good evening, and welcome to another I Dream Live 91.5 podcast. And tonight, we have our mental health workers. And so we're going to be discussing mental health tonight in our Socal Pinoy's Facebook group. We have a lot of different health practitioners and people who work in the medical field, and we've featured different kinds of healthcare professionals. But tonight we are going to focus on our mental health workers. We've had a lot of people ask about having a podcast and discussing mental health in our community. It's oftentimes something that a lot of Filipino Americans or Filipinos in general don't talk about. And so tonight we have 5 guests who are in the healthcare field, who practice in their own areas of their professions within the medical field. But they all have something in common, and they all work with mental health patients. So let's bring them in one by one, shall we?
We shall.
Right, Ed.
Let's go. Take it away. Mental.
And so our first guest is
our
Nicole
mental.
Dumaguindian. We've had her in one of our shows before, and she's a Filipino community mental health promoter for the Asian Pacific Counseling and Treatment Centers in Riverside County. And she graduated from USC with a Master of Science in Global Medicine degree and spent 2 years as a community health worker in the Cordillera region of the Philippines. And she organizes Kapihan Wellness workshops featuring Filipino guest speakers on topics such as COVID, anxiety, bipolar disorder, depression, suicide prevention, among other topics. And in response to the growing health needs of Filipino youth, she created Kapwa Kabataan, the Filipino Youth Leadership in Mental Health program.
Yay.
Hi,
Nicole.
Hi,
Hello. Good evening.
Very sweet. Good evening. You're very, very young. Huh?
Thank you po.
Yeah, and so let's introduce each one of them, and then we can go into our discussion. And our next guest is actually a licensed marriage and family therapist. Her name is Joanna Domingo, and she's currently working as the Senior Clinical Director and Director of Transition Age Youth Services in a nonprofit community-based agencies. She has been in her job for almost 20 years, and she has experience including providing mental health and case management services to adults and young adults who may be at risk of homelessness or have been emancipated from the foster care industry. And Joanna's work also focuses on skill development and education to help individuals live meaningful lives in their respected communities. So let's all welcome Joanna Domingo.
Woohoo! Yay!
Hi, Joanna.
Hi, good evening
Hello,
everyone.
Madam
Magandang gabi
Joanna.
po.
Yun.
Hi. And our next guest is Dr. Sherwin Imperio. He's mental health advocate with over 14 years of experience in healthcare. Sherwin is a psychiatric nurse practitioner seeing adult patients for both acute and chronic mental health issues in a private practice and community mental health setting. And Dr. Sherwin Imperio is also a faculty and a dissertation chair for doctoral graduate nursing students. And Sherwin is the current president of the Philippine Nurses America, California, Orange County chapter, which is only one out of 55 chapters in the United States. So let's all welcome Dr. Sherwin Imperio.
Woo, 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 woo.
Hi everyone, good evening. Magandang gabi po.
Hi, Dr. Sherwin.
Kaya wala tayong
And-
palakpak. Ayun.
Meron pa nga palakpak sa background. And our next guest is psychiatric nurse Anne Buenaventura. She's a U.S. Navy brat who was born in Iriga City, Bicol, and who moved to the U.S. at 6 months old. And Anne grew up in San Diego, which she proudly refers to as her hometown, but she is currently living in the Antelope Valley. And Anne has been a nurse for more than 20 years, and she has worked in a variety of disciplines in the nursing field, such as case management, school nursing, acute care, geriatric care, and outpatient clinic. But the field of mental health is actually her first love. And Anne currently works with the homeless population of Los Angeles and the field of mental health. Hi, Anne.
Yes.
Joanna.
Hi. And this is actually Anne's fourth show with us. Yeah, and our next guest is Dr. Vania Manipod, and she's a board certified psychiatrist and an assistant clinical professor of psychiatry based in Orange County. Dr. Manipod has built an international following on social media with her Freud and Fashion profile, and she has more than 44,000 followers on Instagram, and it's based on her work to educate and promote the importance of mental health. She connects with her audience through her openness about being in therapy and sharing her own mental health experiences. She is a writer and media contributor for various publications and news shows, as well as an internationally invited speaker. Hi, Benny.
Hi, everyone. Good evening.
Good evening,
Hi,
madam.
how are you doing?
I'm excited to be here with all of you.
Yeah, so this is a very this is something new for all of us, since a lot of us don't really talk about mental health, and a lot of people were asking us they've been asking us for something related to mental health, a discussion or a podcast or a group forum regarding mental health, and it's been months, and so now we finally have one. And it's about time that we discuss this one sensitive and sensitive issue, especially to our in our Filipino American community, right?
That is right. This is perfect for me.
You haven't.
I am mentally disturbed. Ah, thank you that you guys are here. I'm going to ask a lot of questions. Huh? I have to be like this, so all our participants, our viewers will be lively. All their brains will be working, or else everybody will just fall to sleep. Especially right now, it's raining, right? So I have to be mentally. Hmm, hmm.
We all have to be mentally ready,
see,
right?
see, see how
And
you
so,
reacted. See how you reacted on my gestures and everything, right? So
yes, because and we were all kind of worried, like how are we going to start this podcast? How are we going to
right.
present this topic? And one thing that we want to know is that how did you become a mental health worker, and what was your inspiration in working in the field of mental health? So anyone can answer.
I'll go first.
Okay.
Since I'm the I accidentally got into psychiatric nursing. My aunt, when I was taking the board, she was like, "Come apply at my job." She didn't tell me what kind of job it was. She just told me, "Come apply at my job." So I said, "Okay." So I applied at her job. I was 3 weeks after I had just passed the board, and I got interviewed and I got the job. And then 3 days later, I was in charge of a psychiatric forensic unit.
Wow.
That's
Describe.
how I got into psych. But I've always loved it. Like I love that every day is never the same. It's always a different day. So I like that. I like that sometimes you won't see change in people, but then at times you will see a huge change. So it's great. You get to see a
So
lot.
what do you do in a psychiatric forensic unit?
Well, the funny thing is in the forensic unit, every patient has two guards to them. Um, I was really new. I was really green to nursing, so I had no idea what exactly I was put into. But every patient had two guards to them. There was the nurse, myself, a medication nurse, and then we also had a mental health counselor who would just walk around and make sure everybody was safe. So we just, made sure that they didn't leave the bed, which they were practically shackled to. So a lot of those patients were there because they were immigration. They're on immigration hold, so they put them in the psychiatric forensic unit for that.
Hmm. Interesting.
Yeah, it was very interesting. That was 20 years ago.
Sherwin?
Yeah, no, I think similarly to Anne, when I first started out with nursing, I had an opportunity to really see the marginalized population that we serve, the mental health population. And I saw that there is that discrepancy in terms of how those individuals were being treated. Unfortunately, if someone had a psych diagnosis, oftentimes they may not be offered certain things. For example, and I remember this working closely with physicians, the psych patients would not be offered smoking cessation programs just because it was kind of expected that they would be smoking. And that seems to be a habit that most of them do. Yet, when they have them on a medical floor, the treatment is vastly different. Same thing with people that have medical issues. And I feel like, if you're working with someone, you have to work with them holistically. And for me, it really just made more sense to actually, hey, we're not just treating the physical, but also the mental aspect of a person. So that was 14 plus years ago, and I actually got the opportunity to precept. And preceptorship is the last part of our nursing rotation. So I was actually fortunate to be able to precept in a psychiatric facility. And I was one of three that the school allowed to precept in a psych unit. And I haven't really left ever since. I started out in critical care and then eventually gravitated towards psychiatric nursing and now working in advanced practices, psychiatric NP. And for me, I cannot imagine myself doing anything else or working with any other population besides this one.
Joanna?
Um, okay, for me, it's a little bit different. It started from when I was younger. I grew up in a family where my sister had a developmental disability. She was diagnosed with Down syndrome early on when she was born. And so I grew up um, knowing or seeing my family, particularly my parents, taking care of her. And even though she was older than me, eventually, as I was growing up and I became older, I helped take care of her. Unfortunately, she passed away a few years ago. So that was my first exposure to mental health. And then eventually, when I went to college, I studied psychology. I graduated from Colegio de San Juan de Letran. By the way, I'm from the Philippines.
Letranista.
Arriba.
Ah,
And in college, we were exposed to, like different outreach, social outreach projects. We went to the slums. We saw a lot of poverty. We also did outreach services to different mental health facilities, to rehabilitation centers, to you name it, just different places that opened my eyes, and I saw the need for mental health workers. And when I moved to the United States, I took my master's in psychology. I majored in marriage and family therapy. And then again, when I did my internship, I interned actually at this place where I work now. I started there as an intern. And again, I was exposed to the homeless, mentally ill population here in the Antelope Valley. And to be honest, 20 years ago, when I first started, there was a health disparity here in the Antelope Valley. There was a need for services. And I just thought, you know what, this is a field that I want to be in. My heart, it's there. My heart is there to help the homeless, mentally ill. And that's why I'm here.
And Nicole?
Cool. So, yeah, I think my story is a little similar, where I kind of just went with the flow, and this is where my life experience, my academic experiences took me. So I first got my feet wet doing mental health work when I was a substitute assistant in special education classrooms. And in our school district, we have what's called ED, which stands for emotionally disturbed. And those are classrooms from as young as like first grade all the way up to high school. And it was really just eye-opening for me. It was also really fun with those students. And at the same time, just, empathizing with what they're going through, all these unmet needs, and just observing a lot of the stigma on the ground between them and, other and their peers who are not in ED classrooms was really like it struck a chord to me. And then flash forward to around 2016, I was doing a bit of work with medical students in the Philippines, where we took this batch of Ateneo students, medical students, to Mandaluyong, the National Center for Mental Health, right? And that was even more eye-opening, because it's like, oh, wow, right?
Yeah.
This is the homeland. These are where our beliefs and our experiences of my parents came from, and why they view mental health that way, and how is that impacting us here as Filipino Americans, right? And then flash forward a little bit more, 2018, when I did come back to the Inland Empire, I was looking for services for myself from a Filipino provider in the IE, and unfortunately, there was a lack of enough. So I was offered a position to do outreach and really raise awareness about this need in the community. And later on, I was endorsed and recommended to apply as a community mental health promoter with Asian Pacific Counseling and Treatment Centers. So long story short, I went from here, the IE, to the Philippines, and back to the Philippines, still in the mental health field.
Awesome.
And
I like that
Dr.
story.
Manipod?
Yes. So when I first decided I wanted to become a physician, I had no idea what kind of doctor I wanted to be. So in medical school, you rotate through different departments like OB-GYN, surgery, internal medicine, and all that. And in each department I was in, I would spend more time with them and ask them more than just their symptoms. So if they were going to get surgery, I would ask them about their life and their family. And then my attending supervisors were like, they're going into surgery. Why are you spending so much time with them? And I thought, I enjoy talking to them. And it was then when I noticed that the way I can best help people as a doctor is by talking to them. So I decided to become a psychiatrist, because I also noticed that a lot of people in hospitals or with medical conditions, some of them don't get better because we're only treating their physical symptoms, right? But some people are getting better because of their psychological symptoms that they're experiencing: depression, stress, anxiety.
So I found that when I would help them address more of their mood, their anxiety, that I saw some people get better. So I think it's one of those things that we need to acknowledge more, that mental health is an important part of our physical well-being
Mhm.
also.
Amen. I
And
like
going
that.
back to what Dr. Manafod said, what are the most common mental health problems, issues, or diagnoses you see at your current practice?
In my practice, I'm an outpatient psychiatrist, so I see patients. So my goal is to prevent them from ending up in the hospital. I want to keep them as stable as possible. So I see a lot of depression, anxiety, bipolar disorder, but I really enjoy working with populations that are very unique and maybe a little bit harder to treat. Like I treated athletes with like concussions, and then adults with developmental disabilities and stuff like that. So I enjoy seeing everything.
Hmm. And we have a couple of questions from our viewers. So the first one is, mental illness remains to be a cultural issue among Filipinos. How do we open a conversation or discussion among family and friends?
Are you talking more like intervention wise or just in general? Like,
Just in general. Yeah, how do we even start addressing issues, or even um because sometimes when we have problems, a lot of times we don't tell, culturally, as Filipinos, we don't tell other people, right? And that's like the cultural norm that we grew up in. And so, as Filipinos, how do we open a conversation or discussion? What if we have family and friends who may be experiencing some issues, or we see some symptoms? How do we even address it?
Here,
Sure.
can I take a stab at this real quick? I think first and foremost, we have to acknowledge that there may be an issue. And oftentimes, again, culturally speaking, and it's not just the Filipino culture, you do have that stigma attached to individuals asking for mental health services. And oftentimes, that is the very first barrier that people experience is they may feel like they're being judged if they ask for services, if they ask for help. There's also that notion that you may be weak if you start asking for services. Oftentimes, culturally, people are more comfortable asking for physical needs or complaints versus those with mental health issues. So we need to be able to start normalizing these conversations, and let's not make it a taboo when people say, "Hey, I'm not feeling so great. So what are some of the steps that I can do or take to be able to get myself to where I want to be, where I need to be mentally?"
I can answer really quickly too. That was a really great response, Dr. Sherwin. Yeah, definitely. If you observe something, if you know the signs, and one of your loved ones is exhibiting that, it's important to bring up that concern right away, from a place of love and gentleness, patience, and then, of course, to listen non-judgmentally, right? To listen non-judgmentally, and then just be by their side. They may or may not take your advice, which is, or they may or may not take your recommendations, and that's okay. But what's important is that the conversation has started, and by doing so, it lifts a lot of the pain just by having that talk with them, and by showing that you have a concern.
Anyone else wants to add to what Nick and Dr. Sherwin said?
I just wanted to say that sometimes a good way to start a conversation is to just kind of pull them aside and talk to them privately. Don't talk in front of like the entire family, which I know sometimes happens. And, just ask them, just say, I just wanted to check in on you, see how you're doing, how you've been. We haven't talked in a while. And, have a really personal conversation and let them talk, right? And see what they say. I think oftentimes, and I love my aunties and titos and my parents, but sometimes when I open up about things and talk about it, they'll say stuff like, "Oh, just be positive," or "Okay, just pray," and I say, "Okay, I'm done. I don't want to talk anymore." It's okay, but just let them. If they're talking, let them talk and listen to them.
Hmm. And given our rich culture, how do we manage stress, and why is mental health so important to our well-being?
Well, you wanna have parts of our life. There's several. Everybody's well-being, it varies. Like especially like being Filipino, like there's that nakakahiya mentality. Like it's embarrassing to like say like, oh, I feel sad or whatever, whatever it is. So a lot of it, like to like being a person that works in the mental health field, and you hear all these stories, like you can't approach a person the same way every single time. Like they all have their own different feeling of well-being, so like oh god, I totally like went off to like left field somewhere. But like dealing with stress, especially like nowadays, because we're all like isolated and not really doing a lot of things. Like you have to check in on people, like even if it's just like a quick text, like, hey, I just thought of you and I wanted to see how you're doing. Even if they don't respond to you right away, at least they know that you thought of them. Like, because I've noticed a lot of people expressing that they're depressed, but they're not saying it directly to you, but you see it in their thread, like in their Facebook thread. You see all their depressing quotes and whatever, and just that quick like reach out to them, like, hey, I'm just thinking of you and I wanted to check in on you, make sure. You just want them to know that there is someone there if they want to talk, that you're willing to listen.
Hmm. And we have another question from Dr. M. Vito Garcia. So, in the midst of COVID-19 pandemic, when we see a lot of despair among people, countless deaths and socio-economic difficulties, loss of jobs, and hopelessness, how would you address these issues with regards to mental health?
Well, it's really important to address issues right away. Like what everybody said, sometimes if you know that somebody lost their job, or if you know that somebody is going through a rough time, reach out to that person, talk to them. If you think they need professional help, advise them to take professional help or get professional help. Um, and just, like, check in with your friends, check in with your neighbors. If somebody is struggling financially, maybe you can bring them like a basket of or some groceries. If somebody's also, because right now a lot of people are working from home and are struggling. Um, just working from home is stressful, and if you have kids running around the house and you're trying to be on Zoom and or trying to be on a meeting, it's really hard, it's
Yeah.
stressful. So like at our work, for instance, we do a lot of self-care activities. And I'm really grateful because I'm like part of that. I'm kind of like one of the cheerleaders who help out with doing like what we call coffee breaks. So like at 12 noon, you go online and you go on Zoom and we talk about different topics. We can talk about movies, we can talk about food, we can talk about desserts, your pets. They can bring their pets on Zoom and we can talk about them. So just like thinking of different things that out of our routine, especially because we are working from home and we
Mm-hmm.
still need to do something to help our mental health.
Yeah, as humans, we always need like some type of interaction. Like no man
Mhm.
really is
Yeah.
able to survive alone. Like they need that interaction. And especially now that we're not seeing one another in
Mhm.
person, it's really difficult to get that interaction,
Mm-hmm. Yes.
Yeah.
That is so true. We have another question from our viewers. We have a question from Pat Abante Calisura. So, if there's a chance of any individual who has a mental health issue, given that your family has history with mental health? Um, is the chance greater, or the external social pressure contribute to it?
Oh,
That's
uh,
for a doctor.
Yeah, it's a twofold question. So,
yeah.
are the chances greater if your family has mental health history, and so this external social pressure add to it?
hmm So I'll answer that really quickly. So if you have a family history, a genetic predisposition, for certain disorders, it's a lot higher. For example, bipolar disorder is like the strongest that can run in the family, in addition to schizophrenia, like alcoholism, even. But there's also a lot that could be more so situational, like you said in the second question, the social pressures, a lot of stress. So when we're evaluating someone for the first time, we're asking about their family history, what runs in the family, asking about their upbringing, and have there been maybe some trauma and a lot of other things that could have influenced them in their life and the way that they cope with depression and stress, and what they learned and how they deal with stress that maybe they got from their family, in addition to the stressors that they're also going through right now, like the societal pressure. And especially since a lot of people with COVID and pandemic, there's a lot of people who maybe didn't have a family history and have never had mental health struggles in the past, that now that with COVID, they're not able to do a lot of the coping mechanisms like we were talking about. They're not able to connect with their family as much. They're not able to, go out and, out gatherings and exercise as much. So a lot more people are struggling because of that strain.
That's
So,
really great. Oh, sorry.
sorry. I'd just like to echo what Dr. Manipod said. Yes, you do have that biopsychosocial component associated with mental health issues. And yes, in terms of the general population, there's a certain percentage that may be at risk of developing X, Y, and Z conditions. And if you do have family members, again, that family linkage is so crucial. Bipolar being one of the strongest that I've seen so far. And then obviously, when you have things happening, COVID has been the biggest thing happening over the last year, which has caused symptom exacerbation with many of the patient population that I've seen. So individuals who never had any sort of history because of what's happened lately have had mental health issues, unfortunately, and they've been coming out and seeking mental health services. So it is possible that someone who never had any sort of history may be developing mental health issues as a result of what's going on in their environments, but also those that have pre-existing conditions and or family members, I should say, and are likely going to have higher incidences of having psychiatric disease.
Mhm.
Yeah, I just kind of just want to add too. So whenever I get those questions in my workshops about um, oh, what about genetic predisposition? And if it runs in the family, yes, that's a risk factor. But at the same time, we have a lot of protective factors as well. Just as you can say, oh, this person has X, Y, and Z in their family, resiliency also runs in our blood. Our ancestors are very strong. They have very strong cultural coping skills that are unique to our Filipino families. So as we look at, okay, so these are things we have to look out for. These are ways that inherently are also tools that we can use when we notice the signs, and we act as soon as we can when we notice mental health issues are arising. So just want to throw that in there.
And we do have a follow-up question from Pat Calasura. So during the pandemic, it's important to know what the difference is between anxiety and depression. How do you know what the difference is, and how can you tell? And what is the boundary of psychosis?
That's a loaded one.
Yes. Anyone?
Yeah. Oh, okay. Well, I'll try. Okay, let's start with anxiety. So as human beings, anxiety is normal because it's like a survival mechanism. That's oftentimes the way it's explained, right? Because oftentimes people think anxiety is bad. It's not bad. It helps you sense something that might be threatening so that you can know how to react and protect yourself. But when it becomes problematic is when your anxiety starts to impact your life. It's like it's harder to manage your stress. Instead of it helping you, pass a test or protect yourself when you're driving and be defensive when you're driving. Instead, it's something you're constantly thinking about, to the point that it starts to affect your daily life at home, at work, etc. So that's anxiety. And then when it comes to depression, we all are prone to normal ups and downs. It's okay. That's part of being a human being. There's going to be things that make us sad and feel depressed every now and then. But if it reaches a point where it starts to persist, it's harder for you to function. It's hard to get out of bed. Sometimes people have thoughts of not wanting to live and stuff like that. It starts to affect your home life and your work life in a negative way. Then that's when it would be important to get help, to see if you can, get some support to help you recover from it. So I think that's part one of the question.
Mm-hmm. Yes. And so how do you know if you're in the boundary of psychosis? That's the second part of that question.
Does the person mean like if they are starting to have I don't know, auditory hallucinations? I'm not sure what the question is really referring to.
Yeah. So how do you know if it has gotten worse? So going back to what Dr. Manipod said about anxiety and depression, if it's affecting your work or other aspects of your life, then how do you know you're going towards psychosis, or how can we tell what the if it has gotten worse to that level of psychosis? How can you tell?
So,
Well, anxiety and depression. Oh, I'm sorry.
go ahead, Joanna.
Okay, I was going to say, but anxiety and depression is separate from psychosis anyway, although there is also a major depressive disorder or bipolar depression with psychosis or with psychotic symptoms. But I would say if they take care of the depression and anxiety right away and they get help for that, hopefully it won't lead to something, like a psychosis later on. But psychosis, of course, and the doctors also can follow up. That's when you start having delusions, hallucinations, you start hearing voices or maybe seeing things other people don't see. So hopefully, your depression or your anxiety won't lead to that.
Mm-hmm. And we do have a follow-up question regarding the history of mental illness in families. So so how do you know if what are the signs, and when do you see the signs of mental illness if it runs in the family? What age does it manifest itself? Is it in children or teenagers, or does it come later in life?
I guess it just really depends, but in terms of practice, you likely are going to see something when individuals are younger. Early adult is something that we often see for those that are having their first break. And again, if there is that family history, and if someone is noticing any of these impact in their daily lives, someone should be aware of what's going on. And then if they're noticing that, let's say, schooling, work, and personal lives are being affected, they probably should be evaluated to make sure that, hey, if there is something that's going on, much like with anything, earlier identification, proper diagnosis, and proper treatment leads to better prognosis. So in those situations, when you have someone who is with strong family linkage of psychiatric illness or mental health issues, I mean, again, you have protective factors. I don't want to just focus on the negative things or the history of someone, but you also just have to be mindful and be open to the possibility that you may be at risk of later on developing something else.
Mm-hmm.
I
And
also want to just put a note out there too. So I guess the topic of trauma has also been talked about, and there's this thing called intergenerational trauma, where just because something has happened in one generation doesn't mean that it goes away, and there's the likelihood that it can be passed down. But one of the ways that can reduce the likelihood of the next generation exhibiting those symptoms of intergenerational trauma is to learn and to enroll in, I guess, like more positive parenting programs and things like that that are put together by mental health professionals and those in the field. So, yeah.
yes, thank you so much. We do have a couple of questions that were asked before our show. So, what advice would you give to a parent whose child is suffering from depression or suicidal ideations, or to anyone who has a family member, relative suffering from depression and suicidal ideation?
Well, I would say I can answer that question. So I would say if you have a child or a family member who is showing signs and are actually telling you that they have suicidal ideations or suicidal plans, I would really advise you to take it seriously, because suicide is a serious matter. If you want, I can also give later on. I can give you the 1-800 number to the suicide hotline, and also make sure you get professional help right away. That's the key. So if somebody is suffering from diabetes or any kind of physical illness, right, we give them medication. So it's the same with somebody who is experiencing suicide. If they get professional help right away, we can give them treatment, we can give them medication, we can give them therapy. Don't discount what they're saying. If they say that, I'm really sad, I broke up with my boyfriend, I really want to kill myself, don't say something like, oh, you'll get over it, forget him. Don't say things like that. Don't discount how they feel, because you don't know if they're really going to proceed what they're planning to do, or do what they're planning to do. Don't want it to get that way. So make sure you get professional help right away.
Mm-hmm.
I just wanted to add. Oh, sorry. Is that okay? I'll go really quick. I just wanted to add, as somebody I've lost several patients to suicide. So it's painful, and sometimes you can't predict. So if if somebody in your family, or if your child, again, mentions it, take it seriously. I know it's very hard sometimes in our family, because we think we know our family members very well, but if it's to the point where it's that bad that they're feeling suicidal, it's serious. So there's another kind of going back to how to approach them again, like being open and letting them talk, because oftentimes when someone's suicidal, it's because they've been holding it in, and they're experiencing a lot of pain, and they don't know how to deal with it. So kind of going along with what Joanna said, being open to saying, hey, let's make an appointment, let's get you help. And it's hard to navigate sometimes. So in addition to the suicide prevention lifeline, when I lost patients to suicide, I also found help with the American Foundation for Suicide Prevention. And there's one in every county, and they have good resources. If you don't know what to do in this situation, they are an excellent resource to contact.
These are all really, really great. Yeah, it's so important to be direct and address the concern right away. And if 911 is an option, but in several counties, there's like emergency teams as well that have trained mental health professionals who will help advocate for the person who is experiencing a mental health crisis, right? And for those who want to learn more about how to have those conversations, there are actual free free workshops based on actual curriculum. It's called Safe Talk, right? And then there's also Assist. There's also Mental Health First Aid. So these are free resources for our communities to learn how to approach crisis, because it shouldn't just be the job of us mental health professionals. It's the responsibility of our entire community. And I just also want to share, like, before the pandemic, there's a statistic based on national study that suicide was the second leading cause of death among Asian Pacific Islander youth. So as harrowing as that is, it means we have a lot of work to do to work together and really address this crisis.
Can I just add something real quick? I think we really need to be able to differentiate that depression doesn't necessarily mean suicide. And if someone is in fact having suicidal ideations, that is a crisis mode, and that's something that requires immediate professional intervention. There's no one who is, again, even family members who may be professional, they should not be dealing with those suicidal individuals by themselves, thinking that they're going to be helping them. Again, it's very difficult to kind of be objective when it's your own family member who's experiencing all of these crisis situations. So you do need to have that timely intervention from a professional that is not yourself.
And we have another question from Dr. M. Vito Garcia. So people tend to think that mental illness is about schizophrenia, bipolar, major depression, and so on. And so he's curious about neurocognitive disorders for older individuals. Can you talk a little bit about dementia and Alzheimer's as it relates to mental health? Anybody?
Oh, okay. So in Alzheimer's or any type of dementia, there's also always the possibility of a psychological disturbance secondary to the dementia. So, there's a lot of people with Alzheimer's who don't have as much of the psychological issues like the agitation, but a lot of them could also have delirium, which can make them prone to having hallucinations and all that, just because their brain is a lot more sensitive to changes, like if they have something like a urinary tract infection, or if their electrolytes are off. So any type of change, or if maybe they're not getting enough sleep, they could be prone to hallucinating and having agitated behaviors. So in those situations, we treat it symptomatically. Sometimes medications can help. A lot of times it's a lot of behavioral type things. So teaching the family, especially if the family is the caregiver, teaching the families how to make them feel at home, make them feel comfortable, make them feel like they have a sense of something to do, right? So that they don't kind of get depressed, because they're very prone to different type of psychological manifestations related to their dementia.
Yeah, and I was gonna say, you actually often see depression happening with, especially those that are in their early stages, because many of them actually try to hide what's going on cognitively, and they do that by isolating themselves. They limit their interactions with family members and friends, and before you know it, they're experiencing depression along with the neurocognitive issues that are going on. And again, there are medications that we use to kind of slow down the progression of those conditions, but not necessarily reversing it. At least not that I'm aware of. And that's not really my population that I treat. However, I do have some patients that are already in those stages upon inheriting them. So.
And we do have another question from our viewers. Is autism and child mental developmental issues mental health problem, or are these separate mental states? Anybody?
I can speak a little bit about it, but again, I'm coming from a not medical school background, but I worked with students with autism, and it's kind of one of those, for me, in my experience, it was one of those gray areas where you have this disability, and with that comes all sorts of feelings and emotions and things like that. So it was common for them to have anxiety because of how they were perceiving different pressures and things like that, and trying to adapt to a lot of the stressors in their lives too. So maybe other folks can add on.
Yeah. People on the autistic spectrum, a lot of them have like behavioral disturbances also, and a lot of them can have genetics that make them more prone. So a lot of people I treated, adults with developmental disabilities, like autism, Asperger's, they have like ADHD, impulsivity. They could be prone to depression or have bipolar disorder type traits. So again, it's kind of similar. I mean, kind of reflecting back to what I said about Alzheimer's dementia, for people who have developmental disabilities, they're prone to having a lot of psychological disturbances also. And the way that gets treated is, like, as far as if they were to see me, is I would try and manage their symptoms with medications as much as possible. But for people on autistic spectrum who have those types of psychological difficulties, there's usually a lot of county community type resources to help them succeed as much as possible, like day programs. Sometimes they have like a mental health advocate who's kind of like someone they can connect with and helps them maybe when they go to school and stuff like that. So there's good resources out there.
Mm-hmm. And so someone was just asking about how the Filipino community perceives that speaking about mental health is taboo. How do we approach this kind of perception? So we're talking about large scale. So how can we, as a Filipino American community, or as a Filipino community as a whole, address the issue that we are not speaking or talking about mental health?
I mean, works like this is actually good education for our kababayans, for our Filipino, because yeah, mental health stigma is really an issue in the Philippines. It's an issue for our kababayans here in the United States. But yeah, just doing a lot of education, maybe even like doing suicide prevention talks. Like Nicole was mentioning, seminars, workshops. I guess that you offer the community. So doing a lot of those and just educating our kababayans, Facebook, and like what I said, podcasts like this. So maybe we should do more of this.
Okay, and
Can I
to
just add something real
our
quick?
okay.
All right, I think really it's being able to openly talk about mental health issues that really will be the beginning, and hopefully we can normalize it enough in where it's no longer a taboo. Much like with anything else that's a taboo before, unless you actually start talking about it, you're not going to make it less a stigma when you're discussing someone's overall mental health status. And again, the educational part of it is great. That could be something that we can do, but also that follow-up. And again, just kind of having people really say, hey, you know what? I think Dr. Manipad, it's cool to talk about mental health. I'm kind of stealing that from you right now. It is a cool thing. And again, as someone who's been doing mental health for quite some time now, I think that it's really something that we need to be more open about. And if we're able to kind of share our own struggles, and again, for anyone who says that they have 100% just healthy mental health, I don't know if that's necessarily true. I think we all have to acknowledge that sometimes we are struggling, and our struggles are very different. And many of us have different coping mechanisms that we utilize. And part of that could be from our own experiences. But we just have to be open to the idea that, hey, we're struggling. It's perfectly okay. And our feelings, our emotions are all valid.
Mick, can I add to that just really quick, super quick? Okay. I've been doing social media and talks and like media type things for 10 years. And at first I was just addressing mental health issues in general and being open about myself being in therapy. Like I've started therapy a long time ago and I'm still see a therapist and it's excellent for me. But what caused me to change the population that I focus on. So I focus on addressing everybody, right? Trying to make mental health relatable. But what I found by being a Filipino American physician, I started getting messages from a lot of people in the Filipinx community saying, because of you, I decided to talk to my parents about it. Because of you, I decided to go to therapy. Because of you, I tried to talk to my parents and create more of conversations around mental health. And these are from Filipinos, so young youth. So I didn't know that. Like I didn't fully address the Filipino American community until recently, because I feel like it's definitely something that we need to discuss. And I think by us being out here, what we're doing right now, being open about it and being open about our own mental health struggles is what can change it.
I have one quick thing to add too. We say talk, discuss, educational discussion. But in my experience, it was hard to get them in those discussions. That's how strong the stigma was. We have to sing about it. We have to laugh about it. We have to shine light because it's a very dark topic. And when we did our youth program, we told them, pick a topic and come up with a way to overcome stigma. And our youth, 17 of them came up with songs, they painted, they did watercolor, they created all these amazing forms of art to tell the stories of why it's important to talk about substance use, to talk about trauma and all these really dark topics. And it was great. It was inspiring and it was very uplifting, especially during this time of COVID. So definitely as many creative means as we can to put out not only just our identity as Filipinos, but our identity as Filipinos who can overcome mental health challenges. There were even a few projects that addressed how do we maintain our spiritual health and mental health, right? These are conversations that are very necessary, very new, but when we have a lot of people coming together to talk about it, then the problem becomes smaller and solved sooner.
So we all. Oh, sorry.
We have a question here from one of our viewers, from Jennifer Alfonso Lee. She's asking, is it nature or nurture?
Combination.
Combination. There you go.
Sorry to be quick, but yes, combination.
It's a combination. And so we all know that working in the mental health field is hard and can get draining at times. And so how do you manage and cope with daily stress and practice self-care?
I want to go. I haven't really spoke much. Like for myself, I learned a very, very long time ago that when, especially being on a locked unit before, that you have to separate work from your personal life. Like you cannot bring work home. Like you have to literally imagine putting it at the door and leaving it there and just going on with your normal day. Because if not, you're going to end up like with so many chips on your shoulder or so many rocks on your shoulder that it's going to be hard for you to cope. So you have to learn how to separate your personal life from your work life. And for me, like I used to dance a lot of hula and all these other things just so I would be able to get fit and get myself like mentally, do something enjoyable. So you have to do self-care.
Yep.
Anyone else?
I can share. So shout out to all the stay-at-home mommies, because I'm a stay-at-home work-from-home mommy while my partner is still in the Philippines. So the way that I manage and balance and practice all this self-care is I go on walks with Jaden. So he's kind of my timekeeper. When I'm in meetings for too long, he acts up, and instead of reacting to it, I use it as a moment to take a breath and go outside. And it's good for both of us, right? Running helps me, just interacting with people who bring me joy other than my son, and I really enjoy journaling. And of course, when things get really rough, I'm very open about saying that, yes, I do make appointments to to see my counselor and my therapist, because I know that she's a resource, and I'm very fortunate to have her as a resource.
Mm-hmm. Anyone else?
Can I say something? Kind of like with what Nicole and Anne has already said, I think just practicing self-care has been very important over the last year, especially with the pandemic. I personally, just kind of oversharing here a little bit, but I've been doing at least 5 miles a day for at least 15 months now.
Wow.
And that has been something, yeah, I know, right? So that's something that I've been able to keep up with. And again, it doesn't matter how I do it. I could be walking, jogging, running, but just a combination of getting those mileage for me really helps. I do have a family as well, so learning to balance that. And I'm working from home, seeing patients telepsych. So sometimes you really have to set boundaries. And my work hours are from so and so up until 5 p.m. My wife is a psychologist, so she also sees patients. We've kind of made a pact that here, let's give each other about 15 minutes, 20 minutes to just kind of talk about shop. And then afterwards, everything is about family. And I think for us, especially dealing with these population, you need to be aware that you're going to have moments where you want to talk about what's happened. Obviously, keep on keeping, but at least kind of have that opportunity to vent out whatever's happened in your day. And then afterwards, everything is about the family life. And all of those have been very helpful. I also try to practice daily gratitude, and that's something all of us can really benefit from. And again, yes, everything that's going on is really horrible for a whole lot of people. We can all be grateful for something in our lives. And I think when you do that first thing in the morning, it's been very beneficial.
And so here's $1 million question. When are you happiest at work?
I like the question.
I can tell you, for me, like
Okay.
every year, my work, we have a thing called Golden Bells, and it's like the best day ever. You get to see like your patient come walk across that stage and get an award for their what they've achieved during that year of recovery. It's amazing. It's like the best day for my work. Like you see everybody dressed up to the nines, all hair done and everything. And mind you, these are the homeless population of LA that you're seeing all dressed up like in the most fanciest clothes. You think you're at the Emmys or the Golden Globes or something. Like they're all makeup and everything. It's just the most rewarding thing ever, is to know that you were part of that journey for that person, for them to walk across the stage and be celebrated. Like, Joanna?
Yes, I was going to add to that because Anne and I actually work together. So that's also one of my most favorite times of the year at work. And also, I wanted to add that even the small successes makes me so happy. You know, I work with the youth population, transition age youth, and just seeing them so motivated to go to school, enroll in college, find a job, and then they eventually get a job. Those are like little successes that just makes me so happy on a daily basis.
Anyone else?
I love when I get patients who are new and they're like, they don't want to see a psychiatrist, and they're like, my wife told me to do this. And then after talking to them and kind of making them open up and feel comfortable, and then when they say, oh, okay, actually that wasn't so bad, when's my next appointment? You know, like it's kind of like converting people who were against it in the first place to all of a sudden being believers of the process. So that's kind of my happy moment when I meet with new patients.
For me, it's been seeing progress and improvement from people. And there's plenty of those opportunities, but I think my most memorable one was I saw a patient who had been in treatment for at least a decade. And they eventually had to change providers because of insurance change. And by the time that they last saw me, the family, and mind you, this was an entire family that came into the office and said, thank you very much for everything that you've done. And it wasn't me that did it. It was them, because they were the ones doing the work. I was merely helping them kind of get to where they need to be. And this patient, come to find out, had traveled back to Mexico after not having been back to Mexico for over 10 years because of the issues that they were dealing with. They were basically trapped in their own home. They were able to smile, which is something that most of us kind of take for granted because it's something that we do on a day-to-day basis. But for some of these individuals, it's the simple things. And for me, again, that was the most gratifying thing that I've done, or at least seen in my practice. And I think really kind of like with what Joanna said, the small successes that we see in our patients are oftentimes the most rewarding. And really, it kind of justifies why we do what we do, despite of everything that we're dealing with.
Yeah. Same for me. It's those small victories, no matter how fleeting, no matter how short or long, big or small. Especially when I know that a client or a community member is coming from such a very dark, um, very chaotic journey with themselves or with their family. But then when there's that one moment where they're able to take a deep breath and like feel that sense of ease or calm or respite that they need, even if it's for a short amount of time, it's like you're taking that with them. And, that it just brings a lot of joy that those moments can happen and will continue to happen so long as we continue the work that we do.
Mm-hmm.
I have
That
a
is
question. I have a question. How do you deal with like a patient? Well, it's not a patient yet until they submit that, or they know that they need help. So there are people that they don't need help, but according to the family member, that family member needs help. So they're like in denial that they are depressed or something. They need help. How do you deal with that? How do you encourage that person to be of help? To help them.
For
For
Can
me,
me,
you?
oh, go ahead, go
uh,
ahead, Nicole.
okay. For me, like the number one is to keep the line of communication open, so that maybe they refuse help now, but then somewhere
Mhm.
down the line, eventually, because of the trust and the rapport that you build with them, and continuing to share examples of ways to think about their problem, of how they're being sad, or
Right.
different solutions. Hopefully, eventually, they will open up. But most importantly, keep the line of communication open.
I was going to say something like that, but I was going to say just plant that little seed that, letting them know that you're there, that you're willing to listen when they're ready. You can't force somebody to get treatment because then
Mhm.
they'll retaliate against you because then they're thinking you're the crazy one, So
Right.
you have to approach them with love, like with kindness, and just
Mhm.
let them know that you're there when they're ready, that you're going to be willing to take them to get the help that they need.
Mhm.
anyone else?
I think I agree with that. And the only thing that I'd like to add, though, is in terms of an acute crisis, that is probably the only time in where I will force someone to come in and seek professional help. Otherwise, it makes it very problematic for someone. Again, when someone is that deep into whatever it is that they're experiencing, they may not be rationally thinking. And that is when, again, when someone is in imminent crisis, that's not something where, hey, let me just kind of wait and see, because that's literally life in that situation. And I don't mess with that kind of stuff. I'd rather say, hey, you know what, hate me now, but at least hate me because you're alive.
Right.
And sometimes there is that, some people may disagree, but sometimes there is that need to just kind of impose that initially. And then obviously they need to have that intrinsic motivation to get the help that they need. And again, it's the little wins and setting them up with realistic expectations, so that when they are making those progress, they know that it's a progression and not just kind of going downhill. Also, for me at least, it's about explaining what the process of that progress looks like for a patient. It may seem like they're making moving 2 steps forward, and then some days it seems like they're moving 2 steps back. But when they have that expectation already in their head, then they know that, you know what, some days are going to be good and some days are going to be bad, but it doesn't mean I'm not heading in the right direction.
Thank you.
That is so awesome. And so, what is the best advice that you've been given? Anybody?
Like from a psych perspective or just in general in life?
Just in general, and as it relates to your profession.
Keep learning.
When I was seriously burned out, right before I quit my very first job as a psychiatrist, I did not practice self-care at all. So I remember having this sign and like this picture on my phone that said, put your oxygen mask on first before you help the person next to you or before you help others, because it was not ingrained in my mind at all. So when I decided to quit, I was like, okay, put your oxygen mask on first. so that's kind of the best. Now it's easy. Self-care is easy for me, but it took me like 5-6 years.
Yeah, similarly to self-care, and I think my analogy is more about cell phones. We often charge our phones once or twice a day, depending on usage. However, when we actually think about how often we recharge ourselves, some of us may actually say maybe once on the weekend. And honestly, I don't think that's enough. And for most of us that are working Monday through Friday or having those regular office hours job, it makes it a little bit challenging to say, hey, you know what, I'm going to practice self-care. And you really do have to prioritize it and be unapologetic about prioritizing yourself. You have to say that you matter. And unless you actually believe that, then you're always going to be putting everyone else around ahead of you. And at the very end, that's going to be detrimental to your own overall health.
For me, the best advice I've been given was to integrate with marginalized and oppressed communities. And the reason for that is, I come from a middle-class background. I have a lot of tendencies, but when we go down to the grounds, to the front lines of where our people are at, those who are most in need, it's very humbling. It's very motivating, inspiring, and that's also where we find the truth, right? We learn a lot of things in our academic careers, but to see and to practice, to engage in social practice, that's where we perfect our craft, right? Whatever field we are in, is when we apply what we learned to those who need it the most. Yeah, it's brought me here. I'm very happy.
Anyone else?
Another thing that I wanted to add is always be hopeful. No matter how ill your client is when they first come in the door, just treat them with love and kindness, and a miracle will happen one day. They will get better because they feel that love and care that you give them, and they would follow through with their treatment.
Yeah, I remember one day, working with the homeless population, like one of the members, I did not expect him to tell me like, you don't treat me like I'm crazy. And I said, well, why, how do you treat someone that's crazy? Like, I just say hello because that's what people do. You say hello when you pass by someone, or you make them feel like they're human. I said, I wouldn't treat you any different. You're human. Like, why would I want to treat you different because I know you have a mental health issue, We have to remember that like the stigma of mental health it's very strong out there, and we have to be kind to everyone, especially the patients, like because they notice, like if you're being mean to them, they're like, oh yeah, that person right there, she's mean or whatever. They talk amongst themselves, like they will say like things and treat you the way that you treat them, so you want to treat the people that you serve how you would want to be treated.
Yep.
And so if there's anything that you would like to change about the mental health industry, what would they be?
Can I say I despise insurance companies and the way that they don't, because the way that it is these days is they want you to see a patient in like 10, 15 minutes. And it's like, you can't get to know a patient in 10 or 15 minutes, but that's the pressure that we're put upon because they don't properly, I could go on about this, but I'll just say basically they want you to churn out and see as many patients as possible. And it doesn't give us enough time to properly get to know our patients and clients. So I would love to change that.
Something I would like to change. We need more Filipinos in the mental health field doing this work. We need more culturally relevant providers.
Can I apply for that? I think I'm a perfect candidate. Right, Kuya? Ate?
Tama po. Opo.
And Dr. Sherwin, do you have anything to add to that?
I think just in our field in general, and again, for those of us that are seeing clients or patients, we have a lot of things that we tell them, but oftentimes we don't practice what we preach. And I think it's really crucial when we talk to someone about practicing self-care that we're doing the exact same thing. So that would be something that I would change within the practice. But to kind of add to what Dr. Manipad said, absolutely. You are expected to see X amount of patients in such short period of time. And sometimes it doesn't really make sense, or most of the time it doesn't make sense how you're supposedly treating a patient when you're literally with them for just less than 10 minutes. And I also hate prior auths for medications. Just
They're the worst. They take forever.
Yes.
And so, if there's any advice that you can give to someone who is hopefully a mental health worker hopeful, what would it be?
Be patient.
Yeah.
Right? You
I
gotta
have
have
to
a lot
say,
of
Don't take things personally.
get as much experience as you can to determine if this is truly what you want to do. Lately, before psychiatry, mental health was not cool. It wasn't like a popular career, but now it's like people think you have a great lifestyle. It's easy. It is not easy, and it's not glamorous, and you will burn out unless you truly want to do it. So be sure that you want to do it for the right reasons, which is to help people, listen to people.
And I want to add to that too. Oh, I'm sorry. That like you can if you really want to work in this field, let's say like in my field in community mental health, there are agencies like ours who accept volunteers. So you can call your local agency, mental health agency, and see if you can volunteer for maybe a few weeks or to up to a month. It's up to you and how much experience you want to get. But yes, agencies like us, we welcome volunteers.
Yeah, speaking of that career, right?
Hmm.
Back in the days, like we go 30, 40 years ago, this career is very seldom, right? Like Nicole mentioned earlier, she went to Mandaluyong because in the Philippines,
Hmm.
Mandaluyong is very famous for that place,
Right.
right? But now, go everywhere, it's like Mandaluyong now,
Hmm.
especially here in the US, right? So, Dr. Sherwin mentioned it's a combination of both, right? Nature and nurture. Do you think uh, nutrition is also a part of that, right? What we eat. That's why we get all this Mandaluyong stuff.
Vanya, go for it. Go for it.
I can say the Filipino diet is not necessarily conducive to the most positive mental health, but as long as it's like good, quality meat and all that, then it's okay. Kind of like going back to the province and it's like raised in your backyard, that's okay. But most of the studies these days, you have, processed food can contribute to depression.
Right.
It's more about eating non-processed food, veggies, fruits, basically the Mediterranean diet. Lots of good studies on improving and preventing depression.
Mhm. There we
And
go,
really, really
Go ahead.
quickly, if our viewers have questions, which I'm sure they do, they have a lot of questions about our topic. Where can our viewers find you?
Facebook. There we go. You got their names right there, oh.
Yeah. So
McD.
aside from messaging them on Facebook Messenger, or any of you on other social media platforms,
Are we able to comment on it so it's on the feed to put our link?
yes, you can.
Yes. Put your Instagrams, all of that. Facebook page.
See how.
You can personally put your phones to me. Yeah, seriously, because I have a brother-in-law.
I can't
That's
type.
why all those questions I'm
So
asking.
I know that Dr. Vania Manipod actually has an Instagram account, Freud in Fashion. So that's something that you can check out. I've personally followed her account,
Wow,
and
doctor and fashionista, huh?
It's stylish to talk about mental
Stylish
health.
doctor, right?
yes,
Stylish to talk
and
about
it's
mental health.
really opened to a lot of people to openly talk about mental health,
Yeah.
right? Because she has more than 44,000 followers on Instagram. And when I
Wow.
saw that, I was like, oh my gosh, that's a lot of people, right?
Yes.
It's more than the population of Socal Pinoy's Facebook group.
That is 29,000 in your group is impressive.
Yeah.
Almost going 30 now.
Wow.
We're really close to 30,000, and so I just wanted to thank everybody here who's here in our podcast about mental health. Thank you so much to each and every single one of you. I know a lot of our viewers have learned something, and it's something that we should do more of so we can move the needle to talking about mental health issues in our own families. It's something that we should do more often, right? And so this is just the beginning. And do let us know if this podcast was helpful, if you want more of these types of podcasts and shows, so that we can invite people like our guests tonight to our podcasts. And so once again, thank you so much. And we do have a raffle. So in I Dream Live 91.5 podcast, we always
Yes.
have a raffle. And some of our SoCal Pinoy's vendors have agreed to raffle off some of the stuff that they sell. Are you guys excited?
The most
Do
favorite part
it.
of the show. Raffle time.
It's raffle time. So if you want to enter the raffle, hashtag iDream. Yes, and so we'll do the raffle, and then we'll say our goodbyes and see you later. Yeah, and so our first prize actually comes from Leila Ortiz-Luis. It's one Marc Jacobs scarf at a $98 value,
Wow.
from Leila of Luxury for Less by Leigh. And you can find her on Facebook and Instagram. And so that's the picture of the Marc Jacobs scarf, and that's a $98 value. That's our first prize. And our second prize is from Claire Bella of UV Care. And so it's one UV Care germ stick. It's a rechargeable handheld sterilizer that eliminates harmful germs, bacteria, viruses, and it's timely for what we're going through right now. So we want to eliminate a lot of harmful germs. And it's a $42.99 value from Claire Bella of UV Care.
Yes.
And our third raffle prize is one Scentsy flower fragrance and one Scentsy circle. That's a $20 value from Meliza Santiago of Scentsy. Yeah. So we'll give you guys a couple of minutes so that we'll, our viewers have a chance to enter the raffle. Arvin's gathering all of the names. And yeah, so we'll be drawing for the raffle in a couple of minutes.
Yeah, like that scarf, ate. Imagine 98 bucks. No wonder I'm getting allergy because I'm wearing 98-cent scarf compared to 98
And
bucks. Huh?
so really quickly, like so really quickly, what's next for each one of you,
Treat patient tomorrow.
our guests? Sherwin, you look like you're ready to answer. Dr.
No,
Sherwin.
sorry. Um, yeah, no. For me, it's just kind of making sure that we do have that openness. And again, ever since I've been doing this, I've been all about mental health advocacy. So that work will not stop, regardless of where I'm at. But if I had to do it all over again, physician, psychiatrist, so that would be perhaps in the next lifetime.
Amen.
And Anne, or anybody, Joanna, Nick, or Vania,
Sure.
what's next for
I'll
you?
go next. So for me, my husband and I are actually volunteers of the Archdiocese of Los Angeles, and we teach marriage preparation classes for engaged couples. So that's
Mhm.
something that I want to continue doing. I consider it my second job, and also eventually I would like to venture into private practice and maybe also help those individuals who don't have medical insurance, or are, offer them like low cost psychotherapy or no cost psychotherapy.
Nako, that's
Okay, I
nice.
think we're ready.
Marriage counselor right there.
I'll tell you what's next for me. I want to open up nursing care. Oh, actually, not nursing care homes, but more like independent living facilities for the mentally, with people with mental health issues. Because I noticed, like, having come from the background of inpatient, a lot of those people, they get discharged and they have nowhere to go, or they're constantly being like kicked out of wherever they go. So
Mhm.
I want to provide homes for those people, throughout Southern California, or
Mhm.
maybe your other states, but mostly California.
I can share a little bit. So, like last year, a lot of my focus was Filipino youth and those sorts of things. And this year, we got a grant to do work with older adult Filipinos. So that's kind of like my shift in not only learning, but also how can I serve them. And because I've been hearing just so much about, there are these barriers to addressing the mental health needs of our frontline workers. They're so busy, they're so burnt out. We can't put them in workshops because they have too much to do. Like, okay, challenge accepted. How can I boost the resiliency of our frontline Filipino workers and their families? And who's down to help me, right? So it's January, and I hope that this year will be really fruitful in the populations that I really want to reach out to.
And I'm creating a program on to help people overcome burnout, especially healthcare workers. So I'm hoping to launch that in the next couple months.
And these podcasts, we've seen a lot of people want to collaborate with each other. So this is also an opportunity for all of you, our guests, to collaborate with each other if you have any projects. And so I think we're ready, right, Arvin?
Yep.
You've entered all of the names. And
Yes.
so, yes, let's do this raffle, shall we?
All right.
Okay, so this is the first one. It's the Marc Jacobs scarf, $98 value from Leila Ortiz-Luis of Luxury for Less by Leigh.
It's so clear. 98 bucks.
Yes,
All
and
right. You guys
so
ready?
yeah, are you guys ready?
They're ready.
All right. Let's do
All right,
it.
let's do this. Is everyone excited? Can we get a drum roll?
We're late. Lizelle!
Lizelle Frigiana won that Marc Jacobs scarf from
Woohoo!
Leila Ortiz-Luis. And
Yes.
so we'll put all of the winners and the raffle sponsors in a group chat so that they can coordinate with each other on how to fulfill the raffle prizes, whether it's pickup or delivery or shipping. And so we'll do the second raffle prize, which is one UV Care germ stick from Clarabella of UV Care, and that's a $42.99 value from Clarabella.
All right, here
Are
we
we
go.
ready, Arvin?
Yep.
The drum roll.
Oh my gosh.
Amy Bondo.
Amy Bondoc, oh my gosh, you won. So this is probably, I don't know, the 8th time that Amy has won something.
Eight
Um, yeah,
the eighth wonder
yeah,
of the
it's more than
Socal.
5 for sure, but congratulations, you
Wow.
won one UV Care germ stick from Clarabella of UV Care. And so this is our last prize for the evening.
Okay,
This
last
is raffle
call.
prize number 3, 1 Scentsy flower fragrance and 1 Scentsy circle for a $20 value. That's from Meliza Santiago of Scentsy. Okay, let's do this.
Yan. Oop. A hairline.
Congratulations, Vince Casica. You won one one Scentsy fragrance and 1 Scentsy circle. That's the fragrance and the bottle in one from Meliza Santiago of Scentsy. Congratulations.
I think this is his 7th time.
And so congratulations to our winners. That's Lizelle Frigiana, Amy Bondoc, and Vince Casica. We'll put you all in a group chat with the raffle sponsors.
How are you?
Kuya Ed, you didn't win anything, but that's
Yeah.
okay.
Join.
We are the host. Hello,
We are
that's
the
not
host.
fair. Yeah. If I'm a guest to another podcast, I will be joining in, right?
Yes.
That's mental
so-
toughness. No.
Thank you once again. Thank you so much to all of our guests. You guys are awesome. And hopefully what we're doing is really, moving the little, if for a little, right? In discussing mental health in our Filipino American community and hopefully getting rid of that stigma once and for all. I mean, it's not happening anytime soon, but hopefully we're moving closer and closer and bridging that gap. So once again, thank you so much. And if any of you have anything to say to our viewers, please do so. You guys have anything to say before we say goodbye?
Thank you for watching, everyone. And remember,
Okay, since I want to say something for the finale, thank you all. Thank you for that great information. There is a proverb saying, laughter is the best medicine. Amen?
Amen, as always.
Amen.
Yeah.
Alien.
And so thank you so much, Anne Toriano Benaventura. Thank you so much, Dr. Sherwin Imperio, Dr. Vania Manipod, Nicole Dumagindin, and Joanna Domingo. Thank you so much. And of course, thank you to our viewers for sticking around. And congratulations to our raffle winners. And tomorrow, don't forget, we have iDream Live 91.5 jam sessions. And so every week we are presenting our Socal Pinoy's musicians, songwriters, and vocalists in a curated show. And tomorrow we're going to have jazz night. And we have 4 artists who will bring us, like a lot of really cool stuff tomorrow. And so I'm really excited for tomorrow's show. Yeah, so don't forget, 8 o'clock tomorrow, jazz night. Yes.
Everyone is invited.
Everyone is invited. Thank you so much to everybody. Good night.
What's your name?
Bye.
Thank you, everyone. Have a good night. Happy New Year.
Thank you for inviting us.
Thank you so much.
Bye.
Good night, everybody.
Good night.
Night.
How do I log out?
chance.